to your questions, if you have any.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hi, we're back. It's Dr. Lederman, the Radiosurgery Hour, and we're talking about cases. I want to talk about a man, 53-year-old black man. And why do I say black man? Some say, why do you say? Because black men have a 50% higher, actually 100% higher death rate from prostate cancer. So it's very important for men who wish to be screened and evaluated and treated for prostate cancer. We believe the black community is more affected and more seriously affected, but in fact every man has the same risks. It's just that there's different issues in each community. This is a 53-year-old man. He's married with 5 children. Went to the hospital with pain. He was found to have a PSA, this blood test, prostatic specific antigen of 900. Biopsy of the prostate showed a Gleason 8. So Gleason was that pathologist that tried to tell us how aggressive the cancer is. Well, obviously this man with a PSA of 900 and a Gleason 8 has a very aggressive cancer. He had a bone scan that's showing the cancer had already traveled to multiple bones. So he's a 53-year-old man, father of 5 with metastatic stage 4 cancer, and he was elsewhere in another hospital, and they left him in pain. He's not able to work. He's in a lot of pain. Came to us August 12th, and we started treatment to get rid of that pain because the cancer had traveled to the bone. We do pinpoint treatment to the cancer, and he just actually came in yesterday with his wife, and his pain in the hip, where he was having so much difficulty, is gone away. But like I told him, he may well have pain in different sites, and when you take care of the worst pain, then you feel the next worst pain. So for him, we took care of pain number 1, and we may have to treat 2 or 3 sites to get him totally out of pain. So the big pain that he had is now gone. Now he has pain in the back, and we're going to treat that back pain. What does radiosurgery do? Well, radiosurgery allows us to hit the cancer, and prostate cancer is very sensitive. So usually the pain goes away. I had one man who was 90 years old. He was so afraid of radiation, and then we talked about it, and he got treated, and now he loves our treatment because we're able to treat him without side effects and take away the pain. This was a white man, so radiosurgery, radiation works for anybody. Actually works for almost any disease, but I'm talking about anybody who has cancer-related pain. So this man, 53, with metastatic prostate cancer, he's doing well. His pain where we treated has gone away in just a few treatments. That's also something different with us. Most people go to places that get 10 or 20 or 30 treatments. No, with us, it's just a few treatments, so it's more convenient. And because each treatment's more intense, it's faster relief. And because each treatment is focused on the cancer area, there's less side effects. So the patient wins. Why? They win because of faster treatment. They win because of more focused treatment. They win because of more effective treatment in less time. So that's what it's about at Radiosurgery New York, and that's what we try to achieve for every patient. We have a young woman, beautiful young woman. She's a nurse with metastatic breast cancer, and actually she had multiple brain metastases. We treated some several months ago, and then she was due to come back. She didn't come back. She went to a neurosurgeon this week who opened up her head because she didn't show up for her outpatient treatment. So I'm sure she'll never do that again. She prefers radiosurgery treatment that takes place outpatient. You just come in, zap, hit the cancer, and all the cancers that we treated in the front of her head went away. So I saw her new MRI scan. Yeah, we treated her 2 months ago. Everything that we treated went away, and now she has these tumors in the back of her head, 2 of them. One had surgery on. I wished, and she wished even more, that she'd come for the follow-up treatments, but we're going to clean up the debris. Surgery usually can't clean up the debris in the brain because for surgical treatment of cancer, you have to get margins, which means you have to get tissue around the cancer. Well, in the brain, that means cutting out your normal, healthy brain, which is kind of a no-no. We don't want you to lose your function. That's the beautiful thing about radiosurgery is it's non-invasive treatment. There's no one's hands in your head. Radiosurgery of the brain means we make a comfortable, non-invasive frame, which is totally different than Gamma Knife. There's no screws in our system into the skull and scalp. That's what Gamma Knife does, has 4 screws into the scalp and skull. Our system, no. Totally non-invasive. Come in, get a treatment, get up and go to lunch or go to work or go home or do what you want. We think it's better if you do what you want. So for her, we treated 4 tumors 2 months ago. They're all under control and remission. The other 2 tumors we are treating now, and actually the first treatment was yesterday. Took 15 minutes. She came in, did great, went home, and we'll give her the last couple treatments in the next week or so. I have another man who came in, hit a PSA that rose to 11, no biopsy. He is 65 years old. He had a biopsy and showed a Gleason 7 cancer. He was going to have a biopsy at another hospital, but they were going to take 2 months to do it. He came to us. We got everything arranged for him. He has a Gleason 7, PSA 11, so most likely in our facility he is going to be cancer-free. How do we prove it to him? Well, we're going to get PSAs and tests and physical exams, and our treatment will allow him most likely to keep his sexual life and urinary life, to avoid radical surgery, and we think that's what men want with prostate cancer. The 4 things. We believe that most men with prostate cancer want to avoid radical surgery because they know when they see the data there's better results with non-radical surgery. We believe men want to keep their sex life, keep their urinary life, and have the highest degree of treatment success, meaning no cancer. And is it possible to be cured of prostate cancer? Yes. And we'll show you the data. Or if you want the booklet, you can just call us during the work week at 212-CHOICES. Why is our phone number 212-CHOICES? Well, 212 is New York City. Choices means you have choices. Just if someone's pushing you for surgery for prostate cancer, you do not need to have surgery. And you'll actually see the data when you come in with better quality of life, better sexual function, urinary function, avoiding radical surgery, which is a bit like filleting the fish because the prostate sits between the bladder and the rectum. So we believe most men don't want to be filleted. They want to keep their quality of life and have a better outcome, non-invasively. And that's what we do. But another man I just saw yesterday who has esophageal cancer. Now, it's not localized, it's metastatic. So he has 3 sites in the esophagus and several painful sites in the bone. So we were able to treat his esophagus non-invasively. He had 1 treatment last week. He's having another treatment this week. Total is only going to be 5 treatments. And most likely we're going to be able to control his esophagus cancer where we aim the beam, and we'll stage him up and see what happens to him. He actually went to another facility. They wouldn't get a PET scan for him. They wouldn't tell him exactly where the cancer was. He came to us the same day. We got him staged up. We gave him the answer. He knows where it is. He has copies of the reports. He has copies of the pictures on a CD. He can look at his own situation so he can understand that. We like people to understand exactly what's going on. And in that frame of metastatic cancer, we had a 57-year-old man who came in. He was born in Guyana, South America. If you know where Guyana is, if you do, good. If not, you might want to look up an interesting country. 57-year-old man from Guyana who had prostate cancer and severe back pain. He's had back pain for 6 months. He had a chest x-ray which didn't show anything, but then he went to another hospital and he had a bone scan and he had a biopsy, but still he has the pain. Okay, they diagnosed him, but they left him with the pain, and he's got numbness in the legs. Well, numbness in the legs is always worrisome because with metastatic prostate cancer, the cancer often travels to the spine. If the spine starts touching the nerves, it can squeeze off the nerves and paralyze the person, man or woman. So many men get that from prostate cancer. Many women get that from breast cancer. So if you have numbness in your legs or weakness in your legs or feel like your legs are not right, I would suggest you come in immediately. And for this man, we immediately got testing. We got MRI of the spine because we wanted to evaluate whether the cancer was touching the spine, compressing the spine and damaging the spine. And he has his answer immediately. The answer is no, thank God. We're going to treat his cancer. We're going to relieve the pain and suffering. There is no cord compression, but we will take care of his cancer pain and his metastatic cancer from prostate immediately and get him relieved, like the other man I told you about who has metastatic prostate cancer spread to the bone. And for other men who are not diagnosed, you may want to take these as a warning sign that, yes, prostate cancer is still out there, and prostate cancer can hurt you, and prostate cancer can even take your life. 250,000 men a year are diagnosed with prostate cancer. It's a lot. And if you think about a football stadium, that's 3 or 4 football stadiums of men who are diagnosed with prostate cancer every year. And about 40,000 will unfortunately die. We believe less would die if they came to us. So you certainly are welcome at Radiosurgery New York to be evaluated, to be treated, to see what's going on. If you have symptoms, wake up at night to urinate, to have pain or suffering, or just want to know what your PSA is, give us a call at 212-CHOICES during the work week, and we'll be happy to make an appointment for you if you wish. That's up to you. Your choice. My name is Dr. Lederman from Radiosurgery New York, and we're going to take a short break to hear from our sponsor just for a moment. We'll be right back, and we'll take your questions and talk more about cancer treatment.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain